I would like to present you this group. The name is KOMPASS, and in German it's a nice abbreviation for the same meaning as in English, compass. I like that, but it wasn't my idea. I developed this social skills group together with Philipp Götzschl since 2004. The manual is now in print, and so we could start 2 other groups in other areas of Switzerland. Last year and 2 years ago, and in this autumn there will be 5 KOMPASS groups in the whole German-speaking area of Switzerland. Up to now, 9 groups were held in Zurich and 7 evaluated. And I can rely on the data of 4 groups of the so-called beginners groups. Beginners groups deals with the modules emotion, small talk, and non-verbal communication, and develops perspective taking and empathy. In the advanced group, I saw that. Right. Okay. In the advanced group, we concentrate on the modules interaction and friendship skills and complex communication. But the sample of these advanced groups is too small to present any data of evaluation. Social activities are organized for all present and former KOMPASS members and sometimes their families. The KOMPASS group, with mostly 9 participants, consists of 26 sessions, each lasting 90 minutes. So it takes more or less 3/4 of a year. According to major reviews, social competence can be learned and understood intellectually. New social competences learned in the KOMPASS should provide participants with different behavior options to choose from depending on the present social context. The implicit rationale of each competence is conveyed and made explicit, for example, on information sheets. Exercise. Hey, I'm moving too much. Okay. Exercises include role play, video feedback, social play, observation tasks, and worksheets. The evaluation of the treatment is a pre-post design with waiting group and follow-up assessment after 1 year. I don't have the data of the follow-up assessments. Parents, teachers, and therapists fill out 1 question about ASS, 1 about social responsiveness, 1 about group behavior, then the CBCL as a screening questionnaire, and the general treatment evaluation. I will present 3 of these questionnaires. This is our sample. We have more boys than girls, but we're happy to have some girls. The age is in the mean 14 years. Some are intellectually very bright, most are average, only a few have learning disabilities. There's quite a high percentage of comorbidity, most of all ADHD. Now the preliminary results. This is the MBIS, that's a questionnaire for autistic symptoms. In the MBIS, the total score decreases. That are the means of the intervention group and not in the waiting list. But the comparison between the 2 groups is only significant in 1 scale, not in the total score. Effect sizes look good, they're satisfyingly or good. Some are weaker. Then we have the social responsiveness scale. Social responsiveness increases. There you can see that we have more effect. Oops, that wasn't the pointer. We have more effects for the group comparison in the total score and with social motivation. The waiting list increases slightly in all scales with symptoms. Effect sizes again are moderate to good. Here we have data of teachers. They mainly see effects with social motivation. And then the last one, that's the increase in social competencies with a questionnaire about group behavior. There we have the clearest effects with the comparison between waiting list and intervention group, which is significant in most scales. That's a small scale with only 3 items, not significant. And teachers can also observe more gain of the group. The limitation of this small study, which is still going on, is a still small sample, even though it's bigger than in most other evaluations of group intervention for children with AAS, which I've found published. As it is typical for clinical research, there are a lot of missing data. Above all, teachers won't send the questionnaires back. And when we began in 2004, not all questionnaires were yet available. For example, the MBIS and the SRS. Okay. Conclusion, in my opinion, is, and from what parents and teachers tell me, that participants benefit from KOMPASS. They have markedly improved social skills in daily life situations, such as connecting more often with others, showing more interest in others, coping better with teamwork, showing polite behavior. That's important when you are looking for a job, conversing more often, more widely, displaying more adequate body language, and trying to understand other person's point of view. Okay. Thank you for your attention.